Thank you. Good morning. My name is Annie Laurie Benzie. I'm the Immediate Past Advanced GI Surgery Fellow at Methodist Richardson, which is outside of Dallas, Texas. Thank you to SAGES and everyone here this morning for the opportunity to present our project. We have no disclosures that are relevant to this presentation. So burnout has become a prominent topic in our surgical literature as of late. It is defined as a psychological syndrome with high levels of chronic emotional exhaustion, high levels of interpersonal job-related stress, and feelings of reduced personal accomplishment. In 2008, the American College of Surgeons actually did a survey which the rates of burnout were up to 40% among their fellows. And this was the greatest predictor of career satisfaction among this group. However, when it comes to surgical fellows, there's very sparse literature on this, on these trainees as an independent group, and even less when it comes to the phenomenon of burnout. So to get more information about this, we hope to elucidate the prevalence of burnout in surgical fellows, to determine if there are any demographic or training-specific characteristics that predispose or protected from this phenomenon in the group. And our hope was actually to gather information that would allow us to develop targeted strategies for prevention and identification of burnout in this group of young surgeons. So we designed a voluntary and anonymous electronic survey that was distributed in December 2020 to all Fellowship Council fellows training during that academic year. Of note, this is non-ACGME fellowship trainees. So not all surgical fellows were included in this project. We queried demographic as well as training-specific questions, and then used 5 previously validated psychological tools. The first of which is the Maslach Burnout Inventory. It's the most well-known and prominently used throughout our surgical literature to assess burnout in surgeons. We also looked at stress levels, perseverance and resilience, personal and career-related satisfaction, and confidence. So once all of our respondents responded to their surveys, we accumulated the data, scored it according to each individual specific tool, and then performed the analysis as follows. So out of the 196 active fellowship trainees during this academic year, 92 of the fellows responded for a complete survey response rate of 37% across all question criteria. The predominant respondents in this age group were between the ages of 25 to 34, white, male, born in the United States, did not have any visa requirements, attended US allopathic medical schools, had no gaps in their training, and there were no responses from any colorectal or flexible endoscopy trainees, and the predominant majority of fellowship trainees were in advanced GI or minimally invasive fellowships. We then looked at the Maslach Burnout Inventory, which again defines burnout across the 3 levels of emotional exhaustion, depersonalization, and decreased levels of personal accomplishment. The rate of burnout in our responses was 8.4%. We then, of course, stratified this by demographics as well as training-specific factors. There was no statistically significant difference when looking at demographics. However, there was a very large difference when looking at fellowship-specific types. So none of the hepatobiliary trainees screened positive for burnout, but both of the responding thoracic fellows did screen positive for burnout. And then there was no difference between visa status or medical stool location as well. When we looked at stress levels, of note, the majority of our fellows indicated that they had low levels of stress during their training programs. No fellows, regardless of fellowship type, had high levels of stress. When we look at satisfaction with life, the data trended towards satisfied or extremely satisfied. But again, those 2 thoracic trainees both indicated that they have lower levels of satisfaction. When we looked at the short grit scale, which is measured on a scale from 1 to 5, where 1 is low grit and 5 is extreme grittiness, the average, mean, and median were 2.7, which suggests a moderate amount of grit. When we looked at this by our demographic variables, the only statistically significant difference between male and female trainees. But then again, look at our demographic data, the majority of our respondents were actually male, so it's likely that the data has been skewed towards that. When looking at self-efficacy or levels of self-esteem, again measured on a scale where the maximum is 40 and higher numbers indicate a higher level of self-esteem, the median were around 34, which is a moderate to high amount of self-esteem. And again, on subgroup analysis, there was no difference between demographic or training-specific variables in our fellowship group. And then finally, when we compared fellows with burnout versus fellows without burnout, of all 7 fellows that had burnout positive, they all indicated moderate levels of stress, and this was found to be significant. When we looked at their satisfaction with life, fellows who were burned out tended to be more dissatisfied with life based on their scales. There was no difference when we looked at their grit. However, there was a statistically significant higher level of self-esteem when we looked at fellows that did not screen positive for burnout. So again, just to wrap up, notable results. 8.4% of the responding fellows experienced burnout in our study. There was no clear demographic nor training-specific factors other than that the HPV fellows had no evidence of burnout, and both of the thoracic trainees did screen positive for burnout. And when we looked up at our comparative analysis, fellows that were burned out had higher levels of stress, less satisfaction with life, and lower self-esteem. Limitations of this study, as I mentioned before, this only included those in Fellowship Council approved programs. So trainees in surgical oncology, transplant, trauma, critical care, and other fellowships were not included in this study. It's also very difficult to exclude any kind of confounding variables because even within each subspecialty fellowship type in surgery, there are many different variations in terms of training curricula, geographic limitations, and even case volumes. This was conducted during the COVID-19 pandemic, so it's unclear the influence that may have had on our respondents. However, previous studies conducted in residents actually indicated there's a very negative response impact of their training based on the coronavirus pandemic. And then, of course, this was a voluntary survey, so there's always a selection bias as part of that. So in conclusion, the 8.4% burnout rate in our fellowship trainees is well below that of reported in the literature for other groups of surgeons. Self-selection, choosing to do an additional year of training, autonomy, so having more responsibility when it comes to patient care, increased levels of specialization where individuals can choose the cases that they would like to participate in, as well as the mentoring present because of the decreased mentee to faculty training ratio are likely protective factors against burnout in this population. But of course, we would always like to look at our surgical fellows as a whole, so further studies looking at across all different subspecialty fellowships and other non-fellowship council trainees is warranted, but especially focusing on the thoracic trainees as both were found to be positive, screened positive in our study. Thank you very much. I'll take any questions.